So let's talk about how did I come up with a waiting list. So I don't have a waiting list all the time. Sometimes things are busier than others, but during a busy time, I could be getting like 3 new calls a day wanting help. So I want to help everybody, but I also realized if I help everybody, it's not good for me or for you because you're not going to get the time and quality you deserve. So let's think about it this way. I have 30 active clients that I see weekly. That's going to be a different experience than if I have 60 clients that I see every other week. So this brings up the question, people want to see me every other week. Yeah, I don't do that. I don't think it's effective. I have often asked people that have been to therapists before that say, hey, I went to therapy for our marriage, it didn't work. First question is I ask, how often did you go? And they'll say every other week or once a month. And it's like, yeah, it doesn't work. You won't remember what you're working on. The therapist won't remember what you're working on. Also, therapists that are overburdened at state agencies, bless their hearts, but here's the thing, often that you don't even get to see them because they're so overworked, except once every other week. So you're just not going to get better. Well, you could benefit somehow, but it's more of an information gathering process, and then I would dispense information, and then you go run and use that. So I like to see people weekly. Often people say, well, I can't afford it. I say, well, then save up for that. You know, maybe if you saw me 4 to 6 weeks in a row and that you'd be done. Because you would have gotten the answers to the challenges you face, and you would have learned enough of the skills to put them into practice. And once you start practicing them, you probably won't let go of them. So what qualifies to get on the waiting list? Well, here's the thing. If it's something I really specialize in, that not a lot of other therapists do, then it's probably a good idea to wait. The question is, it may be urgent, but is it worth waiting for? And maybe you should find another therapist. I do have a page on my website that has links, and under that links area there's going to be therapists that I recommend, so I would go look at that. So yeah, that's how the waiting list works. That I will call you, and there's a lot of factors. It's kind of like an algorithm. If you're on, you get in based on how severe something may be. Like if it's going to keep you from going to a hospital, I may see you sooner. Second of all, if you can come weekly, I mean, you get on the list that way. 3, your insurance is probably a good fit, or you can afford it out of pocket. 5, if it's something I really specialize in, you know, and then neurofeedback I do a lot of work with, so from there, that's a factor. So these things line up. What do I specialize in? Addiction recovery, anxiety, people who struggle with OCD, some people with psychosis, people with needs for recovery in terms of any kind of addiction. Work a little bit with compulsive gambling as well, compulsive sexuality, compulsive overeating, compulsive shopping, spending, debting, and then drug and alcohol. But I work a lot with some depression, some anxiety.